So here we've got an exercise called a scaled lunge. The reason why it's called a scaled lunge is because we're going to use this movement to transfer from a shallow lunge into a much deeper lunge, but we're going to add a pillow or a cushion underneath for some stability. Now the benefits of the lunge are that they improve your stability, they improve the strength of the muscles acting around the knee, the ankle and the hip, and arguably into the lower back as well, via a variation of this movement which we're going to try later. But they're overall just a fantastic exercise to rehabilitate the lower extremity, i.e. the leg. So for a scaled lunge, you can see here that I've got a pad, and the pad is fully folded up, so you've probably got around 4 times 1/2, probably around 6 inches of height there. Now this is going to make a big difference, because what I'm going to do from this position is I'm going to lean over my front foot. The back leg works as just a stabiliser, like a tail, and then from here I'm going to push the knee out that way to open up my hips, and I'm just going to drop my knee down until it touches and back up. Now the good thing with this is patients who fear stability, even if you bail out at the last minute, you can always put your knee down for a bit of assistance, and then back up, down, and then back up. The benefit of this as well is it enables us to challenge the bottom up movement a bit more, because you'll be less scared or less unstable at the bottom of the lift, and less concerned about putting your knees to the floor. So it might be that when you're doing this you feel quite good, and you feel maybe about 3 out of 10 level of discomfort or less, which is fantastic. So we can do this to warm up, or we can start off straight away with a lower position. So if I just halve the height of this now, the effort is going to dramatically increase for me to get to the floor. So from here, my knees out, my chest is up, weights on my front leg. I'm just going to lean forward and drop that knee to the floor, and then back up. So the effort now that's required probably already increased by about 30%. I'll just show you this from the side as well, off from this side. So from here, my foot is forward, my knee is out, and then from this position, I'm going to drop the knee to the floor and back up. You'll see that it's very important that my knee falls out. If it doesn't, it's going to block me. So here, my hip is too tight. I need to open it up to fall to this position and then back up. Now the benefit of doing like this as well is we can add a lot of weight to this movement without having too much of an effect on stability at the bottom. I'll show you. So here I've got a 12 kilo weight plus my body weight on one leg. From this position, I'm going to go through the exact movement, same movement without the weight. I'm going to pick up the weight and stand up. The weight now stays in my hand, and I begin the movement. From here, going to drop down. Just my knee touches the floor, and then back up. Knee out, down, and up. Knee out, down, and up. Now, the most important part here is that we don't bounce out the bottom. So from here, I'm not looking to boom, bounce out the bottom like that. I'm looking to gradually guide myself down, touch, and then come back up. You can really stabilize yourself at the bottom by planting that knee if you want to, but ideally you would just touch and go, touch and go, touch and go. So as soon as your knee touches the bottom, you then come straight back up again. I hope that helps with your lunges. Once again, it's a fantastic exercise to rehabilitate knee instability, the anterior structures of the knees, for example, patellofemoral irritation, but as well as that, the muscles of the hips, so the hip stabilizers and ankle stabilizers as well as mobility. Give them a go. Any issues, book a free consultation or book a full assessment if you like, or if you're already seeing a practitioner here at the clinic, then just give them an email, give us a call, and we'll refine your exercises as we go. Thank you.